Hello everyone. Today I want to briefly discuss about common traumatic disorders of the lung. When there is an injury to the lung or chest wall, several common conditions could occur. The first one, flail chest. Flail chest occurs when multiple ribs got fractured and result in floating of one segment of the whole rib cage. As a consequence, one part of the chest wall could be unstable, and patients will have paradoxical breathing, which means that the chest wall will collapse when patient inhale and moves out when patient exhale. The lung underlying the injury contracts when patient inhale and bulges when patient exhalate. If we don't give any treatment, the ventilation will be impaired, which can lead to poor oxygen, which called hypoxia, and respiration failure. The symptoms of flail chest could include chest wall abnormal movement during breathing, severe chest pain, shortness of breath, fast heartbeat, and cyanosis, like bluish of the lips, skin. The second condition, pneumothorax. Pneumothorax is a collection of the air in the pleural space, causing the lung on the injured side to collapse. What is a pleural space? Pleural space is a hollow space covering the lung to maintain its normal expansion. However, when the air actually travels into this pleural space through injury, now the pressure will build up in the pleural cavity and push the lung to another side and cause the lung to collapse. A pneumothorax may be open or closed. In an open pneumothorax, an injury creates an opening in the chest wall, allowing air to flow into the pleural cavity. In a closed pneumothorax, the chest wall is still intact. However, the air enters the pleural space from another opening on the surface of the lung. So when the lung got a hole there, and the air travels from the lung into the pleural cavity, we call it closed pneumothorax. Depending on the severity, a pneumothorax may cause severe shortness of breath, hypoxemia, lack of oxygen, tachypnea, fast breathing, and severe chest pain. Patients could also have diminished chest expansion and breathing sounds. Sometimes the sound could feel really abnormal, like a sucking sound may be heard. Tension pneumothorax is a very severe form of pneumothorax, which occurs when air escapes into the pleural cavity and continuously increase the air pressure inside the pleural cavity, make more and more pressure, and then progressively collapse the whole lung tissue. Now, when there's pneumothorax, emergency treatment must be given, and doctors need to aspirate the air from the pleural cavity immediately. The third condition is hemothorax. Hemothorax is accumulation of the blood inside the pleural cavity, usually as a result of trauma, like external injury to the chest wall, like a knife cut off the chest wall. The signs and symptoms of hemothorax could include shortness of breath, chest tightness, and lack of oxygen, loss of blood, severe bleeding. If treatment is not provided, Hemothorax could lead to shock from heavy bleeding and severe pain and respiration failure. So remember the difference between pneumothorax and hemostorax. Pneumothorax is a collection of air inside the pleural cavity, and hemostorax is a collection of the blood in the pleural cavity. So we know that pleural cavity is a space that covering the lung to maintain the lung normal expansion to protect the lung and separate lung from the chest wall. However, if this space now is injured. Now, when the air or blood travels into this space, it could increase the pressure inside this space and push the lung to another side and cause the whole lung to collapse, which is very, very dangerous and traumatic. Thank you for listening and hope you could gain a little bit more knowledge about the common traumatic disorders of the lung.